I'm Dr. Gardner, and today I wanted to talk about one of the most common questions I get asked, especially when I do blood work on dogs, and that is, will this blood work tell us if my dog has cancer? And there's not really any one blood test that is going to tell us whether or not your dog has cancer, at least in most cases. But a lot of blood work can be very suggestive of a very specific list of cancers, or at least lead us in a direction. So I wanted to talk about some of those today. So the first one makes a lot of sense, and that is any type of cancer that's going to affect the blood. So something like lymphoma. So with lymphoma, you're going to see a lymphocytosis, you might see abnormal lymphocytes, and you might also see a thrombocytopenia or low platelets or an anemia. The next one is leukemia, where a lot of times you'll see a very high white blood cell count, and this is one of the more common cancers that is diagnosed based on blood work or bone marrow. And then also multiple myeloma. The next group is solid tumors that have characteristics in the blood work that can be very telling. So the first is hemangiosarcoma, and with that you'll often see a regenerative anemia and sometimes a thrombocytopenia along with some other blood changes. The next is a mast cell tumor, so occasionally you'll see circulating mast cells, and while that's not very common specifically with that cancer, when you do see it, it's very concerning. And then anal sac adenocarcinoma. And so with this, you'll see hypercalcemia, so really elevated calcium in the blood, and that can also be very telling, and it will help you lead you down the path with the next steps in terms of your physical exam and with other diagnostic tests. Lymphoma is also another one where you can commonly see a hypercalcemia. There are also some specialized blood tests, so if you start with a basic CBC or chemistry, or if you have a senior dog and you do a senior panel every year, which I strongly recommend, there are other tests that you can do after that if you have any specific findings that are suggestive of a problem. So overall, there are a couple blood patterns that if you do see them on your dog's blood work, you should be concerned and consider taking the next step. These include unexplained anemia, a persistent hypercalcemia, so elevated calcium, an unexplained or low white blood cell count, and a paraneoplastic hypoglycemia. So the bottom line is that annual blood work for your pet, especially if they're senior, can be very helpful. And while it's not going to definitively tell you whether or not your pet has cancer, it can certainly be helpful in diagnosing a lot of other issues, and it can also help you in a diagnosis of cancer in terms of leading you in the right direction or being very suggestive. I hope that that was helpful to you, and I hope you will consider getting annual blood work on your pet because it can be super helpful, and I will see you next time.